To order the Burleigh County Human Service Zone Board. Today is Tuesday, December 17th. It is 3 p.m. I will start by, we're going to skip to the third agenda, which is the reappointment of board members before we call roll call because we have a new board member. So I just want to go over the reappointment. We had 3 positions that were coming open, so we did get approval from the county commission for reappointment of Senator Dever to continue on our board, as well as Trevor Vanette. Trevor is not here today, but Trevor was reappointed for three more years for the zone board. So we had an open position from Leslie Piercy's leaving the zone board, and that was open through application. And yesterday, the county commission made an appointment for that position. So we will do the oath of office for Kelly.
I even voted for you, Dick.
In the legislature, when you get reelected, you take the oath again.
All right, raise your right hand. I, Kelly Burleigh,
I, Kelly Burleigh,
do solemnly swear that I will support the Constitution of the United States
do solemnly swear that I will support the Constitution of the United States
and the Constitution of the State of North Dakota,
and the Constitution of the State of North Dakota,
and that I will faithfully discharge the duties of the office
and I will faithfully discharge the duties of the office
of Human Service Zone Board in the County of Burleigh
of Human Service Zone Board in the County of Burleigh
and the State of North Dakota,
and the State of North Dakota,
according to the best of my ability,
according to the best of my ability,
so help me God.
so help me God.
Congratulations. I'll get you to sign it.
Okay, and I did ask Kelly if she would just do a brief introduction for those who are here, who don't know her background, as well as those who are interested in observe this zone board meeting.
Hello, I apologize. I am Kelly Berglund. My background is financial institution internal audit, so more of the business aspect of it. I am currently the mayor for the city of Lincoln. And after that, I realized that that was quite an investment in time. So I stepped back from public working and am doing, or I guess now I'm more public work than the private sector. My desire to be on this board, I think it's a very important role to have, our kiddos, our future. My family is very in tune and supportive of the foster care program. We've got a couple adoptions in our family throughout that process, so that's very dear to my heart. So I'm hoping just to continue on in serving in this aspect rather than the other. So I appreciate the confirmation today.
Yeah, thank you. We're
Thank
happy
you.
to have you on the board. Thank you.
Thank you.
Welcome aboard.
Thank you.
Okay, so we'll move to the agenda item then. That was number 2. We'll do the roll call of the members.
Commissioner Bakken,
Yes.
Kelly Berglund,
Yes.
Senator Dever,
Here.
Tracy Famous,
Yes.
Jim Holm,
Here.
and Director Flory.
Here.
And for the record, Galen Becker and Trevor Vanette are both absent.
Thanks, Tayon. Next on the agenda, we'll do the approval of the meeting minutes from the September 17th, 2024 meeting. So I don't know if everybody had a chance to review those meeting minutes. Any comments? Anybody want to make a motion on those?
Move to approve.
Okay, we have a approval and a second on that. So any discussion? Just put that out there in case anybody has anything. If not, we'll just do a vote on that. So all in favor, say aye.
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 Any opposed, same sign. Motion carried. The next one that we'll do is the zone board, zone board meeting dates for 2025. So I did send these out to the board members. Sorry, Kelly, you didn't get those yet because you're here today. But I did send those out so we can look at those dates and make sure that they work for everybody. Again, we're going to keep it the consistency with Tuesdays every quarter, and we did 3 p.m. It just seemed to work better for everybody's schedule.
And that's, just for clarification, the third Tuesday of every month is the way those dates continue to flow.
Anybody have any questions, conflicts?
I have MPO, but typically it doesn't take that hour.
Okay,
Today was a little longer meeting than usual. so-
okay.
It's easy when it's upstairs rather than over Mandy.
Correct.
You want a motion or anything on these dates?
Motion to approve. Second.
Okay, we have a motion and a second. Any further discussion? Hearing none, all in favor of those approval of those dates, say aye.
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 Any opposed? Same sign? All right, motion carried. The next thing we'll do on the agenda is the director's report. So we will start with our Economic Assistance Division, and I have my program administrator who will give Gray, and she'll give updates on the unit that she oversees. Nope,
How about now?
good job.
There we go. Okay, so just some quick updates on some things that have been going on in our office. September 18th, we had a management evaluation review on site. This is where a SNAP policy person came in. They did some SNAP interview observations to ensure that policy was followed. They did some cases that were needing correction, some case file reviews that needed correction. They were received back to the zone. We have made those corrections and turned those back in. Some of the notes that we found, potential findings, use of income and expenses, timely processing, narratives needing more detail and information in them. As far as improvement planning goes, of course, we're going to make sure that we're double checking budgets before we are authorizing any cases. Continue working statewide for timeliness. There's been some backlog with some issues that have caused the timeliness that we've had, but we are on the mend for that. And then shifting work within capacity, more explanations in the narratives, and then when it comes to IPVs, making sure that the violation, that we are able to show the burden of proof that a violation had occurred. One of the was a couple of positives that came out. They did say when she was conducting the SNAP interview observations that throughout the interviews, the workers did include policies and rights, responsibilities for the client that they needed to hear, and to their reporting requirements, making sure that they understood what their requirements were.
Okay, I just wanted, for clarification for board members and for Kelly. So the work that we do in North Dakota for economic assistance is done statewide. They have what they call lanes where the work is flowing, where group 1 will do just Medicaid, group 2 will do Medicaid, and then if that household also has SNAP, which is your food assistance, and then group 3-4 does kind of the additional programs like your TANF, childcare. So that's how the lanes are separated. So when we talk about timeliness, I just like to clarify that it's not a direct impact from Burleigh County's timeliness. This is because statewide work is processed the way it is. So we could be processing applications for benefits from a resident in a whole nother county on the other side of the state. And then the zones up in that, we could be processing for Grand Forks for us. That's kind of how it works. It goes into a statewide queue. The work is grabbed in the order as received. Some things are expedited based off of household composition and that kind of stuff. But so when we talk about timeliness, it's not, I can't drill it down like you probably used to just Burleigh County because the way it's done. When we talked about shifting work within capacity as a state as a whole, we really spend a lot of time looking at those lanes and moving workers nimbly and fluidly through the lanes. And so we may find that we have backlog in group 1, which is your Medicaid only. We had the public health emergency that was earlier this spring, right? The PHE unwinding we did, or was that last year already?
I think that's been going for the past year.
Yeah. So when that was lifted, we saw an increase of work that needed to be done. So then we had to shift worker, so we just kind of moved the workers nimbly, fluidly to where the work is at. when the winter seasons come, we see an increase with our LIHEAP applications, because that's just the time of year you get heating assistance. That's our heat, yeah. So, just wanted to clarify, just so you understood, when you talk about timeliness and shifting of the work capacity, those are decisions that are made much higher than just a Burleigh County decision. So, yeah.
When it comes to some of the programs with LIHEAP, of course, this season started October 1st of this year. I do want to note for you guys, this will be our last full-on application season, as we will be moving to review process with LIHEAP. So there will no longer be an application process at October with the benefits or the case closing at May with them having to reapply again in October. This is going to now move to a review process. So the state is working on getting that set up so that the reviews are kind of stair-stepped out and scattered out, so that we're not hit all at one time in October, but yet they'll go throughout the year. Unfortunately, I don't know how this is going to work yet. They are still in the process of trying to figure that out. The applications right now for LIHEAP, now that we're into December, we are now processing timely, and we are up to date on the LIHEAP applications. With childcare, this program back in spring, I want to say April, was moved from Group 3 to our Group 4, which, as Chelsea had mentioned, this was our group that works all of the programs, the TANF childcare, SNAP healthcare, and LIHEAP as well. So childcare did get moved into Group 4 because there was some moving around with the LIHEAP so that we wouldn't get so hit in October, and so they spread LIHEAP out to Groups 2 and 3. Because of that, they took childcare off of Group 3 and put it onto Group 4. This did cause some backlog in the Group 4, moving that childcare program. So one of the things that they are currently working on right now is they have moved the childcare cases back to the original workers who worked in Group 3 doing childcare. So they are helping out Group 4 right now with those childcare cases. Let's see. On Thursday, 12/5, this is when they decided to open up the queues for those original Group 3 workers. And on that day, 458 childcare work items were pushed out into those workers' queues so that they could help the Group 4. Keep in mind, this is a temporary fix to address the backlog work for Group 4. Right now, they currently have 10 individuals that are in the training process for the TANF and child care programs. So once they get all of those individuals completely trained so that they can work the TANF and the child care programs, they will then reassess at that time to see if they have enough workers in that Group 4 to now handle the workload with the child care and the TANF and all the other programs, or if they need to add more workers to that group at that time. With healthcare, we are still kind of in the middle. Well, I shouldn't say the middle, but we're getting to the end. But open enrollment for healthcare did start on November 1st. The public is encouraged to apply for healthcare during the open enrollment period. This is an annual process, and it goes until January 15th. Because of the open enrollment for healthcare, we have seen a big increase in the number of applications being submitted through the Federal Facilitated Marketplace, or this is the healthcare.gov website. This, of course, with that big push, has also created a little bit of a backlog within the Group 1 as well. Workers are processing roughly 10 applications a day right now with those that are coming in.
Okay, before we get into, I think that's all the
programs,
the program stuff. The only other thing I would add is, yeah, I mean, it's not great conversation to talk about having backlog clients getting delayed in getting their benefits. As a zone director, that's not what I would like to see for timely processing and then getting those services to those individuals. But I will say that we're trying to do the best we can to shift the work. Workers are maybe doing work that's outside their typical. They're getting extra training. Other thing we're doing is we offer, and again, statewide, not just Burleigh County, but we're encouraged to offer overtime for individuals who are willing to work outside their normal hours to process the backlog. So just thought the board should know kind of efforts that we're making to do that. Any questions regarding the programs, backlog, anything like that? Okay, sorry, Gray.
That's okay. Let's see, back in October, on the 17th, we did have our first official in-person all-staff meeting. We had kind of talked about that before in other zone board meetings here, that we were going to start doing this on a quarterly basis. So we did have our first official one. During this staff meeting, we did have an individual come from the Village Business Institute and give a training presentation on subject called compassion, fatigue, and employee burnout. The presenter did have lots of good information that was found both informative and useful in not only our work lives, but also in our personal lives as well. I did have several of the staff reach out at that time to express that they did appreciate the meeting and the speaker and the information that was given. And as of right now, it's not on the calendar yet, but I am looking at having the next all-staff meeting planned for sometime in February or March.
Yeah, the only other thing I'd add to that is obviously through a lot of that conversation we just had about programs shifting, it is change fatigue on our team members. I mean, that's just not for Burleigh County, but statewide. We continue to move the work they're doing, how they're doing the work, who's doing the work, those kind of things, and that does cause that compassion fatigue. So there's also been some changes with the redesign that was implemented where we went away from doing case management to process management, and really what we're seeing is we remove the person from the why. Like you used to sit across from your client as a case manager and really be connected to that person and that individual, and now you're just working a task in a queue. So it kind of causes some of that compassion fatigue as well. So we're really trying to, and Gray will get into the next item, but we're really trying to do more outreach because we have a lot of workforce who want to be connected to the why and want to be connected to the community. So we're trying to do a little bit more outreach that will help our citizens.
So yeah, we are currently doing some outreach with the Department of Corrections right now. We have 2 of our eligibility workers going out to the state pen once a month. I think it is that they're going out. They are meeting with those individuals who are within 30 days going to be released. And so that way we can go ahead and get their applications completed and filled out at that time instead of if we have applications come in that aren't entirely filled out. This is going to kind of, mitigate that process where we have all of the information that we need. They'll be able to answer the questions that the inmates may have at that time. So we started that on October 31st, I think is when you guys took the tour. And they went out, I think, twice in November.
Yep.
Twice in November. And I don't know if they've gone out in the month of December yet.
This week we go. Yep.
Okay. So I know they continue to do that. The 2 team members that are doing it have expressed that they really enjoy it. They feel like that they are really making a difference as far as getting those applications. They are keeping the applications and processing them as the inmate gets released and we get notification from the DOCR that they have been released. They will then process that application because they have it there on their desk ready to go. And we're looking at doing more outreach in the future too. We've got Chelsea and I have talked about some ideas of other things that we can do.
So any feedback from the board on the outreach of other ideas for outreach? Like some things we've talked about is we partner a lot with like Global Neighbors for refugee programming that they offer for programs that they may have they're eligible for, and so there's some ideas of us partnering with them and trying to they're there to provide that advocacy for that individual, and then we're just there for the technical application processing, as well as probably checking in with our homeless coalition, things like that. Like where could we do outreach? But I'm open to any suggestions. So
Madam Chair, could I just ask when you go out to the prison, what programs you're dealing with?
So in that one, mostly Medicaid, but there's also some instances that they may be eligible for SNAP when they're released also, especially if they're released back into the community in their own home. If they are going to another facility, they may not be eligible for SNAP because their meals may be covered for them. So we're really taking a look at how are they being released, where are they being released to, and focusing more on that Medicaid and the SNAP when necessary.
So continuing medications that they took at the prison.
correct. I mean, the goal is continuum of care. So when they're in the prison, they're getting that through a different source, and then once they're
Correct.
released, we're finding that they're on their own to come and sign up for it, and that doesn't always happen. So we're bringing the services to them in hopes to have continuum of care.
But it's critical that they continue their medication.
Correct.
Yes.
For stabilization, yeah. And a lot of them have health concerns too, that those medications are needed. And like Grace said, Medicaid is the biggest one, and then we do SNAP based on where they're going. If they're discharged into a facility that provides the food, then they don't apply for that. We also had one individual who was releasing straight to a home that he owned, and he was able to like get LIHEAP, things like that are applicable. So we offer them all the programs, but the two main that we're focusing on are Medicaid and SNAP.
And did you still want me to explain the interview process that we have for our office?
No, you're okay.
Okay.
Anybody have any questions for Gray? Or economic assistance? Okay. Thank you. Okay, next on the agenda will be our update on our child welfare unit.
Hi, my name is Jeremy Smith. I'm the program manager for child welfare here in Burleigh County. I'm going to start off with a couple of initiatives that we have been going through and working through for all of child welfare, and then after that we'll get into some of the different units and stuff for working knowledge. Couple of the initiatives. One is a motivational interviewing. We are working on, I believe, a couple months ago when I stood up here, I talked about motivational interviewing before. We're still going in that initiative. It's going to be a very long initiative, probably about a 2-year process to get everybody kind of up to speed in the training part. Motivational interviewing is really a technique. It's a different perspective on how you engage families, non-judgmental ways of and working with the families and not being resistant to their work and stuff like that. So about 75% of our staff right now are trained in the motivational interviewing. Now they're moving over to learning groups. So learning groups are supervision now. So it's not really training, it's supervision with a consultant through Case Western University. And their work is really bringing in cases and talking about cases and how you can handle that and how you can work through these cases. And like I said, they're called learning groups. We'll have 4 different learning groups. We are combined with different zones. Mainly Rough Rider is in the Bowman area. We're combined with them within the learning groups here. Next is trying to obtain the next staff members that haven't gotten the training, which are our supervisors in the case management area, and then also new staff that we've hired in the last couple months. Those individuals hopefully will get registered and attend the motivational interviewing 2-day training either next month or March. They haven't set a date yet because the dates and coordination really does get set at the state level and not the county level or zone level. Right now we're working with UND, University of North Dakota. They received a grant to work on an initiative through working on Native American culture, working on how we can look at data differently, and things like that. And we're collaborating with UND and the NADI, it's called. So the National Native American Training Institute. And there's different staff. They're all called IFPs, so ICWA, Family Preservationists. And they're part of this group that they're working with us. And we're identifying different gaps in our community. One of the gaps was trying to keep that culture alive with our children in foster care, the children in foster care that are Native American. And sometimes they are placed outside of a Native American home. So we're helping out these foster care providers, understanding the culture, and then also helping out the kids so you can continue the culture as they see. And that will be tonight, the first event. Chelsea will be directing that and facilitating that. And it's called, we called it Keeping the Culture Alive, and it's a partnership with Three Rivers and the state. And Joelle Bearstail will be presenting there. She's the author of a book called Bear's Braid, and she'll be there at 6 o'clock at the public library.
Yeah, the only other thing I'd add is, to Jeremy's point, this initiative is really, I guess, important to me as we're working with families, because sometimes the culture is even lost within that family. For whatever reason within that family, they might not celebrate their own culture. They may have historical trauma that's happening. And so what we're finding in with these kids that are in foster care or in our prevention services is like the sense of belonging. So there's a lot of initiatives that are happening through the public schools for this same sort of initiative, giving children a place to be and having that support. So this was really for that picture of not only for the foster and adoptive parents to have that support and learning opportunity, but for also the children to have a place. So it's really geared towards foster adoptive children, as well as their foster and adoptive providers to come in and learn. I think this is our first event we're doing, and we so far are RSVP'd for 40 people to attend. So it's really great that we have an interest in this, and this, Joel, will be a great, is a good first topic. And so we're just looking to grow more in being able to do these events. Sorry. Thank you, Jeremy.
Thank you. So part of process improvement and quality improvement, some of these items that we're doing, we also need to understand the data. So about a couple of weeks ago, CFS director, myself, and Harmony Bercier, who's through the University of North Dakota that leads this grant, met with Casey Family, and Casey Family has a tool that they bring in. I can't remember what they call it, but they bring in a lot of data through the Census Bureau and then create different demographics and different things that you can look at, whether it's education, poverty levels, just anything in particular. And you can either look at it within a neighborhood, you can look at it within a town, city, county. So we're definitely going to be looking at the data. We're going to be pulling the data and comparing our kind of reports, through like CPS reports, and also reporting of the public, whether it's public reported or the mandated reporting, and really see what reports are really coming through into our CPS assessments and what reports are being screened out by the state. We don't screen out, when the reports come into us, we don't screen out the reports right away. It is done by the state, a state team. So we'll be looking at data here in the next couple months for that. One area that we saw that there was a gap in the last couple of years was a discontinuation of partial hospitalization program. And Chelsea and a number of other individuals are on a group called Systems of Care Grant. And the Systems of Care Grant really is kind of the lead in working with CHI. So CHI is starting a partial hospitalization program again. And what partial hospitalization program means is if you're receiving behavioral health services or addiction services, it's not going to a therapist for 1 hour a week, or you're not going to inpatient care and staying there overnight. Partial hospitalization is open really just daytime hours. So Monday through Friday, 8 to 5, it gives a chance to get, for these children, whether it's mental health issues or concerns or addiction concerns, they're able to get the supports they need while they're trying to go to school. Because with PHP, or the partial hospitalization program that's going to be starting here, they have collaborated and worked with the school system to offer school while they're at that partial hospitalization program. So a very good program that they're bringing back, that it just wasn't happening the last couple of years, but now we're seeing it coming back. All right, talking about some programs, and I wanted to just, I don't know if you guys all are data people, but I did do some data look. I know it's not the end of the year, but I wanted to do up to December 15th, so I did some data checking and comparisons and things like that. You'll also get an annual report in about a month, looking at actual true data, but I just wanted to run through some data here. Child Protection Services, we are working on just looking at the timeliness and the organization of our workers, because we are seeing an increase in the reports that are coming in for open assessment. So it's just a matter of trying to shift and trying to figure out and mold to a new area of trying to contain those assessments and finishing those assessments in a timely manner. So by December 15th, from the beginning of January 1, there were 2,086 reports given to the state intake. Out of those 2,086 reports, 808 of them turned into an assessment. So only 39% of those reports moved into assessment for us. So that means that, a little over 60% of those reports that either mandated reporters are reporting, or parents, other parents or family members are reporting, 61% of them are already getting screened out at the state level. Just to give you a comparison with 2023 numbers, 22 numbers, and 21 numbers. At 2023, 37% of those reports were screened in. And then at 2022, 34% of those reports were screened in. And then at 2021, 37%. So this year already at December 15th, 39% of those have been screened in for open assessment for families.
And Jeremy, when you look at in your guys' packets, you have the kind of some of the data and then the charts. It appears as though for our child protection assessment team, like we're on trend for where we were in probably 2023. I know this is printed black and white, so you kind of can't see some of those lines, but it looks as though we're not far off from where we have been in previous years. And like Jeremy talked about, for timeliness, that is a measure that all of North Dakota is measured on. For human service zones, we have different ones that we work with the department on ensuring. So I have ones through economic assistance for timeliness, and then we have ones through child welfare. So one of them is the timely response to face-to-face of victims, as well as timely completion of a CPS assessment in according to policy. So those are both areas when I got my last review of my measurements where we have improved, not just for Burleigh County, but statewide. So these are initiatives that we're trying to do, which can include collaboration with other zones. So if you have another zone who might not have a high caseload, they may collaborate with us to come work some of our cases to ensure that we get timely face-to-face with our victims, that kind of stuff. So those are the two that are related to child protection.
All right, so that's, any questions for CPS, Child Protection Services? All right, moving on to case management. I want to start at the beginning before we get into our actual program. Right now, the state is in the process of doing a state redesign of our case management system. We're lucky and fortunate enough to have two of our staff on that committee or that work group. One is a supervisor and one is a case manager. It does take up a lot of time to do these redesign. They did a CPS redesign a couple of years ago, and then we also did an adoption redesign last year. And for those people that really commit their time, it takes up a lot of time for them. So I do want to thank them on the record that they're going to be working on the work group. But it's a variety of different zone members, state workers. There's even stakeholders, I believe, on the work group. And what their purpose is really looking at how we can streamline documentation. You know, there's a lot of documents, especially in the foster care system, that you have to fill out. And that's a huge initiative right now at the case management redesign, is looking at that. One of the other areas that they want to look at is supervision, how supervision can handle this, because as we have so many staff in so many cases, the expectation of supervision is really meeting with the supervisors, with each case manager, and going through each case. And they're looking at how they can streamline that and make it more effective and efficient there. And enhancing the case management tool. So I guess it hasn't been fully rolled out yet, but from what we're gathering, they're really going to be instituting a seamless case management system. So right now, a lot of you hear in-home case management unit and foster care case management unit. At Burleigh County, we've been working on kind of getting rid of the unit talk and really just talking about, you're a case manager, you could either be doing foster care work and providing foster care services to this family, or you would do in-home services and providing in-home services and going out to meet the families there. This gives them a chance for the family members to have a seamless interaction. Before, they would have two separate case managers if for some reason a youth and family, the children of the families were removed and they were receiving in-home services, and now if they're removed into foster care, we would switch the case manager. Now we're not doing that. If they're removed into out of the home, they're going to keep the same case manager. So the families don't have to retell their story again.
The only thing I add about the case management redesign, so that kicked off, I think, in July or August, and that's an 18-month redesign that's led by the department. So we're in it for the long haul. Like Jeremy said, we have 2 team members who are currently actively on it. As they identify work streams, kind of as they get into the redesign and they start looking at certain pieces of the process, they will be pulling our team members into roundtable conversations and looking at those kind of things. But yeah, it's going to be a long redesign, but I'm very hopeful that it'll help us. Their first step was identifying the why. Why do we do what we do, which is to ensure the safety and serving children and families. So really bringing the workers back to what parts of their job are the most important pieces they do, which is serving and direct work with the families, and how do we get those workers back to doing that versus some of the other stuff they're doing. Like Jeremy said, the paperwork, the court process is a big one. There's a large number of my staff that spend a lot of their time doing transports for appointments or visits, and that's not the best use of their time. However, those things have to be done. So it's kind of looking at how can we as a community do more. And we have foster parents who are serving these children, but they can't always do that stuff too, as they have other children and their work and family responsibilities. So what are different areas doing to respond to this need so that it doesn't fall on those case managers who, again, need to be doing some of that more important work with the family. So those are all conversations to be had over the next, we're probably, however far we into it now, I think we got a year left. So thanks, Jeremy.
Yep. Thank you. All right, going into actual case management and just kind of reviewing some data for you. You got some of the monthly data and up to November data in front of you, but I did run some numbers here up to December 15th right now, so just so you guys are aware, kind of as an annual perspective. We've served 258 children in Burleigh County in foster care. So 258 children have been in foster care for this just year alone, right? And we also have served 128 families for in-home services. So in-home services, the main thing in in-home services is prevention of removal. When Child Protection Services does their assessment and then they identify a need for continued case management and continued care and support, they would refer them into in-home case management services. So the biggest thing is prevention. So if we didn't have that prevention and that in-home services, that number would probably be higher in foster care. So just to give you a perspective, one of the big comparisons, though, I want to point out to you is the other larger counties for in-home services. We're working with 128 families within this year. So to let you know, Ward County has worked with in-home cases 50 families, right? And then Grand Forks has worked with 44 families, and Cass County has worked with 27 in-home families. One of the things that they're working and concentrating on is foster care, but our really work is trying to prevent that foster care. One of the programs that has started at West Central Human Service Center that I want to kind of tell you about that we're kind of working with, and it helps our in-home case management services, it's called functional family therapy. So if you've ever heard of FFT or functional family therapy, what it is it's an individual therapist, basically. However, the therapist goes out to the home, and that therapist works with the family, not with one child, not with two children, the whole family, and works on skills and development of family skills, and maybe working on how to work with the youth in the family members. And that FFT program is very committed to these families because they all also have to offer 24/7 crisis work. So if for some reason at 10 o'clock at night a family member, a child is disruptive, that mom or that dad or relative placement can call up that therapist on call, and somebody will be there to respond. So functional family therapy is a very, very intensive treatment program, but we've been working really hard to try to collaborate with West Central Human Service Center to get them into our families sooner than later. One of the areas I do want to highlight. So our CFS director had discussed with the directors and a lot of the supervisors that this is the first year, and we're talking federal fiscal year. So federal fiscal year goes through October through the end of September. So was when we reached face-to-face contacts with case management services. So foster care case management services has to do a face-to-face contact with every child at least once a month. And the state, for the first time for a very long time, I don't even know how many years it was.
I think they said 2018.
2018.
Yep.
Yeah, and met that threshold. The threshold is 95% of the children are seen within that month. So there's various reasons why some of the children aren't seen within that month. But to give you a perspective for us in Burleigh County, we hit 98% for the federal fiscal year and then 97% last year. The year before, we were at 94%. So at 94%, we did incorporate an improvement plan. Just because it was 1% non-compliance of federal standards didn't mean that we needed to work on getting that number up. So we worked really hard at looking at what the causes were. Was it data entry? Are we getting out to these families? Are we getting out to these children that are up in Langdon, North Dakota, or Williston, North Dakota. So we did a lot of collaboration with different zones as well for calling courtesy case management. So they were able to help us out with these visits. So last year it was 97%. This year for the federal fiscal year was 98%.
The only other thing I'd add on that is we do have to rely on other states to provide courtesy case management if we have children placed with relatives in other states. So if they, if a child from here is going to go be placed with a relative in South Dakota, Minnesota, Kentucky, we have to coordinate with their local social services to do courtesy case management and complete those face-to-faces for us. So there is a small portion of it that is outside of our control to ensure those things are done timely.
And I wish I could give you the data for our in-home services, but policy states for in-home services, those children have to be visited, whether it's at school or in the home, 2 times a month, at least 2 times a month. So a lot of case planning happens with those children and family members, but they have to be seen at least 2 times a month. But the data reporting system isn't working really well, so we don't know that data. We really do rely on the KPI system from the state to give us that data. So,
what's the median time a case is worked? So how long is somebody in a case?
For in-home services?
Yeah, on average.
I don't have
And then
that
how often are you
actual-
dealing with multiple?
Right. I don't have that actual number, but anecdotally, I would say up to about 60 days, 60 to 90 days per in-home services, foster care. Normally, on average, I think 10 months, 9 months at best. We do have cases that are 18 months, and some cases that are, 2 months that are successful. That's anecdotal, though. I don't have the actual data.
No, but that's
Chelsea
a
might
good
have.
question. I think for our next board
Yeah.
meeting, something we can definitely grab once we have 2024 completed, looking at the average length and stay. So when Jeremy's talking about some quality insurance, quality improvement planning that we're doing with the state, that's what we look at is the average length of opening for those cases, and especially the kids in foster care, and then trying to drill down to the why. I think in the last board meeting, I talked about we're seeing our Native American children stay in care longer than non-Native children. So we're trying to drill down the why. And is it because they don't have family supports we can reunify with? Those kind of things. So yeah, those are all good questions. Your other part was, you said how long are they open, and then
Yeah, and then how many cases? I'd be curious to see a little bit more of a breakdown of multiple cases within a home on the in-home services. So it's multiple children. And
Sure.
what that number looks like, because that's taxing on resources as well. So
I
if
think
if you got 3 kids versus 1 kid, so.
So I would say to that answer, so in foster care, numbers are counted by the kid, and in home we count, like he
Right.
said, 180 some home or whatever cases, but you could have 7 kids in the home.
Right.
So what Jeremy has worked with our team in doing is develop a weighted system, because not every case is the same amount of work, and so we're really looking at that. I could have a caseload of 12 and you could have a caseload of 17, but my 12 kids could be more complex. They might have DD, developmental disability diagnosis. They could have mental health issues. They could have families that have different dynamics that we have to consider. So yeah, those are all things.
Is there a metric that currently tracks that, or is that something that's part of the
Yeah.
Okay.
So I'll let Jeremy speak to that, because that's something we did in Burleigh County, but it sounds like that's something that's, I'm going to say we started kind of doing that for our own.
Right.
And it looks like it's being picked up and redesigned as from.
Yeah, so right now, the redesign effort is kind of taking our template and trying to work through that. When I first came on and understood these caseloads, I knew 1 does not equal 1 for a child, right? But I didn't know how to look at that and do a caseload ratio. And I did do research through like various journals and things like that of how nationwide they do that. And there's not really a good system on how they do that nationwide either. So I started working on this weighting system, weighting basically meaning, does the child receive an extra point for the mental health services or extra services, or does the child get an extra point for multiple placements in the last month? Have they went through 3 different placements? Because that takes up a lot of time. I did meet with a professor at University of North Dakota about a month ago to start working on validation of the tool. I don't know how much I'm going to go forward with that because redesign is taking it on now. But my next step is really looking at that formula, the case ratios, and working with each of the staff members and understanding, do I have it right? And looking at their levels of intensity that they're providing, because more likely my formula is not going to be the best formula, So, but I've been working through that with the supervisors countless times of redoing it over and over. What about this? What about that type thing? So,
I can see where that'd be a very valuable data set, though.
Yes, thank you. So how do you account for the transition, sometimes going from that foster care to the in-house, or the in-home and the in-home, transferring over to the foster care as far as documenting it here?
Documenting, it's in the same system, in our same record system, so that wouldn't move at all. If for some reason, hypothetical situation, if we would have a situation that the children were removed from the home through early open, CPS assessment, then we would identify a foster care case manager, or a case manager now providing that foster care work. They would go through their court process, and then they would work at reunification. Once they work with the bio parents or relatives, that could be a guardian, that case manager would automatically work through that with the court process and drop court orders, or court orders for custody, and we would send it back to the parents or the guardians. So I don't know if you want to answer more. Or
No, I think, so it's like Jeremy said, it's all through the same system that's ran through the State Department that the whole state uses for this, and essentially your caseload may stay the same. It's just we go through the data part of it and change the program.
Okay.
So they may be listed in the system of receiving in-home services. It's the click of a button to say now they're receiving foster care services. If a family is in foster care and we are working with reunification with the parents and we no longer need to be the custodian, we go before the court and say we're comfortable with the parents being the custodian, but we're just going to stay involved to monitor, and we essentially get what we call a supervision order. It is an order through the court that allows us authority to supervise what's happening in the home, still stay on top of everything. Then we go into that system and we switch it over to in-home services.
Okay, perfect.
Yeah.
Thank you.
Yep. So really, the point is, families shouldn't feel the impact from that switch of a button in the background. We really wanted that continuity of care where I, as a case manager in foster care, wouldn't say, oh, you're going to in-home, now you got to go work with Steve. I would say, no, you're going to stay with me, and I'm going to work with you no matter what program you're in. There is a clear separation of our families that receive services through child protection services. We don't, those are concepts that other people talk about. Like, if I'm a child protection worker, I'm just going to carry this case. If you go to foster care, that's not good practice, or very two different hats that you're wearing when you're doing that. I would just
skill set.
Very different skill set, and I would say from lived experience, very difficult to go from a child protection worker and maybe make some findings on abuse and neglect and then turn around and work with that same family. So that's why you hand the case over to somebody else who has the ability to do that. Yeah. So those are very different. Yeah. But case management can be very fluid between the level of intrusion we have on a family with custody or just supervision. Yeah. Yeah, and I would just echo to Jeremy's point about the other zones and our numbers for in-home. That was a big thing for me, was trying to swing the pendulum from the number of kids in foster care to the number of in-home cases we're serving. I wanted to see that shift of that level of intrusion. Obviously, if that's the level we need to keep kids safe, we would, but I think there's a lot of work we can do on prevention, and a lot of that is just getting community services in place for families, getting them connected to different case management programs, free through recovery programs, different addiction services, those kind of things, so that way they can have tools in their toolbox to prevent that. But so I would like to say we've seen a good swing of that, but at the same time, our numbers just keep increasing in general. So
It's nice to see the increase in the parent aid.
yes, yeah.
services.
That one, I will tell you, that one is, as a new board member, that one is a kind of a direct impact to employment, because that is, like a child protection worker, if I'm down 2 workers, I don't get to stop those cases coming in. I can't shut off the faucet. So then I'm just overwhelming people with the work, where parent aid services are based on really if I have capacity to add a parent aid to your caseload. So I agree with you. I'm really happy to see those go up, but that's because we've been full staffed in that unit for probably
For a while, but we've also added positions
Yep.
to that unit and increased the overall capacity to perform those functions. So
Yeah, but agree with you. That is a huge prevention service we use and education of families. But yeah, that one, when you see the dip in the numbers, there's a good good likelihood that if you compared it to my FTEs, you would see that I had a dip in the employment. Sorry, Jeremy, I was just going to see if we had anything else that we were going to... I think that was everything you had.
Yes, that was everything I had.
Any other questions regarding child welfare? Okay, thank you.
Thank you.
Other zone updates. I'm going to be honest, I don't know that I prepared too great for my other zone updates. Usually I try to give you guys just more my overall operations, but it's been a pretty busy few months for just really actually working in those programs that you got updates from Gray and Jeremy on. So I don't know that I have anything too big that would be overall for just the zone itself. Tiana, okay. So I don't have anything, but if anybody has any questions about anything else, I can answer that. Otherwise, we'll go to agenda item number 7 for public comment. We actually do have somebody in the room for public comment today.
Hi, Board Chairman.
You want to turn your mic on?
Hi, Chairman and Board. My name is Mike Conley. I'm one of the Bismarck City Commissioners. I just wanted to make everybody aware. I mean, I'm sure you're all aware that the citizen-initiated measure passed in Bismarck. The goal was to basically save public transportation. It was bleeding reserves. It was going to be out of money. And what do grandmas and grandpas and disabled people do if they don't have access to thrive in our community? And it was more than 40 volunteers that disabled or elderly went out and got the signatures, and the citizens voted on their behalf. But now with that change in a funding source, it's how do we not only stabilize the services that we have now, but grow it to where it's a community asset, to where it can actually help with economic development and hopefully get people that may be accessing the services that the zone board provides, and getting them to grow beyond the services to where they never have to get back on services. Some of the members, the appointments have not been made tonight. That's part of the meeting tonight, but Don Kopp we have a subcommittee meeting starting next year. Don Kopp from the Downtowners, Brendan Nagel from the EDC, Brian Ritter is Public Relations at Sanford, Dustin Geverlow, Kim Ripple from the MPO, Mike Taylor's a user and an advocate from University of Mary, Trevor Van Nett, which you all know because he's on your board, and Deidre Hughes from Transit, Jaylene Chatham's from the PR outreach person for St. A's, and Lane Hoffer from United Way are currently on there. And just making you all aware, reason why tonight, not wait until after we start the meetings and things, is that The zone board doesn't meet like month to month and things. There's some spanses in between. You have connections that we don't have. So as you're talking to people, if you send emails, if you have insights, if there's maybe unmet needs that we're not aware of, just to send that information in so that can be all added to the discussion so we can make it the most efficient use of the resources available to us. We want to do it in a respect to the citizen way to where we're maximizing the use of the resources. And grow it into that asset, like I said. It's a service now, but growing it for an asset to the community so we can be a more special community. Mandan has a separate initiated measure. They're working on it within their own circles and things. So it's really anything and everything. No idea is a bad idea. Share it with us so we can talk about it. If you have any questions, feel free.
Mike, would it be possible to get Luke Chelsea in on your meeting minutes and make sure that they know she's a resource if they have any questions as well?
I can certainly ask that, and I'm pretty sure that would be within accommodation.
Okay, because I think that would be the best point of contact. You know, we know everybody on that board anyway, but I think that'd be the best conduit as far as communications coming through, conveying anything that you guys are seeing and anything that we may have for insights as well.
Yeah, absolutely.
Okay.
So, anybody?
Any other questions? Thank you. Okay, number 8 on the agenda is other business. I don't have anything for other business, so, last item on the agenda is to adjourn the meeting, so thank you guys. It's our last meeting for 2024, so I will see you in March of 2025. Thanks.
Merry Christmas, everyone.